Hello, welcome to Chapter 8, the respiratory system. Today we're going to work on, again, breaking down words, finding, combining forms, roots, suffixes, prefixes. We're going to work on spelling words correctly, defining different abbreviations, anatomical structures, diagnostic procedures. So let's start with an introduction to the respiratory system. The respiratory system here, it starts with the nose. This nasal cavity. This nasal cavity opens up to the outside through each individual nostril. So when we breathe air in, that air is going to go in through that nostril. It's going to go back through this nasal cavity where it's going to get warmed up. It's going to get moistened. We add moisture to the air we're breathing in. It is going to travel down the trachea through, that pharynx, larynx, which is where your voice box sits, past this epiglottis that covers that trachea when you're swallowing food and water to prevent food and water from going down into your lungs. So through that trachea, and then it's going to go down into that left or right lung. From that, when that trachea splits, it splits off into primary bronchi, secondary bronchi, tertiary bronchi. Going to go through bronchioles, respiratory bronchioles, all the way down to alveoli. Alveoli is the main site of gas exchange. They're these little teeny tiny air sacs. It almost looks like a big bunch of grapes, the way they're set up, but it's these little air sacs that are made of that simple squamous epithelium, that really thin tissue that allows that gas exchange to occur. So ventilation, or respiration, I should say, is the process of ventilation. Air moves into the lungs on inspiration. And expiration is when that air moves back out of the lungs. When the air is in the lungs, we will exchange gases. The carbon or the oxygen that we breathe in is going to exchange, go into the bloodstream, while the carbon dioxide in the blood is going to go back into the lungs so we can breathe it out. So our respiratory system, it works to exchange those gases, that oxygen and carbon dioxide. It regulates your blood's pH. Because carbon dioxide actually plays a role in the acidity, how acidic your blood can be. So it's regulated through that carbon dioxide. Protection. We have a lot of different protective mechanisms along our respiratory system to prevent us from inspirating or breathing in any kind of foreign objects or any different kinds of microorganisms. The hairs just inside of your nose help to try to trap some of those microorganisms. Mucus that's produced along the track of the trachea is produced to help trap any kind of pathogens that may have made it down that far. Along with those adenoids, those tonsils, these are all different ways our respiratory system tries to protect us. And then that voice production. So movement of air in that larynx across those vocal cords will produce sound. And then olfaction, that smell. Our nasal cavity there's upwards of 12 million receptors for smell. They're in the very upper portion. So they sit up in here are these receptors for smell. A dog has 4 billion receptors. This is why dogs have such a good sense of smell versus humans that have about 12 million. Some fun. So pulm or pulmonary means lung. Pulmonology, pulmonologist. Spur means to breathe. Respiration, spirometry are some words that contain these two root words. So let's look at the upper respiratory tract. This upper respiratory tract is made up of nares or nostrils. This is the openings of your nose to the outside. We have a septum that is going to divide that right and left compartments or cavities of that nose. That palate, that hard palate here, it's listed, this is what creates a hard floor to that nose. It also creates that hard roof to your mouth. Your nose, that passageway for air, it's an air cleaner or cleanser. Those nostrils or the hair in your nostrils, they're helping to clean that air. Moisturizer, we're going to add moisture to the air we breathe in, as I mentioned, and we also warm that air. If you notice in the middle of winter, if you take a breath through your nose versus a breath through your mouth, if you breathe in through your mouth, that air is not warmed, so you can feel that cold traveling down. But when you breathe through your nose, it does not. And then that olfaction, or that sense of smell. Disorders of the nose. You are high or upper respiratory infection, rhinitis or coryza, allergic rhinitis is going to cause swelling of that mucous membrane in your nasal passages. It's going to cause this watery, kind of clear discharge from the nose, this mucus that's coming out. Sinusitis is an infection of the sinuses in your skull. Most of your sinuses are going to connect to that nasal cavity, so it usually has to do with some sort of allergen, usually a cold. If it's a bacterial infection, they can use an antibiotic. If it's a viral infection, antibiotics are not going to work. A deviated septum is a partition, or that partition in your nose that separates one side from the other is pushed further to one side, so it obstructs the airway of one of those nostrils. This can be fixed with surgery. Epistaxis, nosebleed. It's another word for a nosebleed. So that pharynx is separated into that nasopharynx, oropharynx, and that laryngopharynx. They are separated into those three parts. Pharynx also means throat. So that nasopharynx, you have that combining form, naso, which means nose. Oro, that combining form, mouth. And then laryngeo means larynx. This first part of this word is telling us where we are looking. These tonsils and adenoids. Tonsils and adenoids are masses of lymphatic tissue. Tonsils are in that oropharynx, like this palatine tonsil that you see back here. This right here, you can see the other one right there. That would be tonsils. I have a side view. Here is another set of tonsils. And then we have adenoids up here in that nasal cavity. That is where we find the adenoids in that nasopharynx, which is located right here. Uvula. That uvula is an extension of that soft palate. So it is this portion in the back of your throat that comes down. If you look into the back of somebody's throat, and you have them say, ah, that uvula will rise up. So let's break down some of these words that we need to know. Muke, this means mucus. Nase means nose. Pus, pural, and rhine also means nose. These two, muke and pural, both refer to a form of discharge, while nase and rhine both refer to the nose. Snoring. Snoring occurs when structures within that pharynx, could be the tongue, the pharynx itself that collapses down, the uvula, the soft palate, obstruct the airflow, causing that soft palate and uvula to vibrate. That is what that's how that snoring sound is created. Obstructive sleep apnea is the complete cessation. So they stop breathing during sleep, and it's caused by that obstruction of that airway by the soft tissues at the back of the nose and the mouth. People with obstructive sleep apnea tend to have hypoxia, that low blood oxygen. Pharyngitis is inflammation of the pharynx. Most of the time it's caused by a viral infection, while tonsillitis is when a bacteria or virus gets into those tonsils and it's going to cause an inflammatory effect. Nasopharyngeal carcinoma. This is a pretty rare type of cancer that is treated with radiation and chemotherapy. So let's look at the noun and the adjective form. Pharynx becomes pharyngeal, and our pharynge will be that combining form for throat. All means pertaining to, so pharyngeal is pertaining to the throat. Nasopharynx is going to become pharyngeal. Naso for nose. So the nasopharynx is the region of the pharynx at the back of the nose and above the soft palate. Oropharyngeal or oropharynx becomes that oropharyngeal. Oro is my combining form. So that oropharynx is the region at the back of the mouth between the soft palate and the tip of the epiglottis. Laryngopharynx becomes laryngopharyngeal. Laryngopharyngeal. Sorry, I added extra sounds in there. My combining form, that laryngo or larynx, so that laryngopharynx is the region of the pharynx below the epiglottis that includes the larynx. So let's look at some terms for tonsil. Tonsillitis is that inflammation of the tonsils. When we spell out tonsillitis, we add an extra L. And then that before we add that itis for inflammation. Tonsillectomy, again, we add that extra L before that suffix. Ectomy, giving both of these words, tonsillitis and tonsillectomy, that double L. So the parts of the larynx, we have that epiglottis. Epiglottis is the spoon-shaped kind of flap of cartilage that's going to cover the glottis during swallowing. So it covers up that trachea, that windpipe, so food and water do not go down it. That glottis is the opening of the larynx where air is going to flow every time you breathe in or out. That thyroid cartilage, it's going to form that Adam's apple. It's not very prevalent in females, but in males, you can usually see the point of that thyroid cartilage that sticks out. Then those vocal cords. These are what enable us to make sound as air passes between them. So laryngitis, this is usually a viral infection that causes people to have that hoarseness or that loss of their voice. Epiglottitis, this is a bacterial infection, usually in children. Laryngeotracheobronchitis or croup. This is viral, and it kind of produces that bark-like cough. Papillomas or polyps are growths, benign growths that are found within that larynx. They're usually treated by removal if they cause problems. And then carcinoma of the larynx is caused usually by years of smoking. It's that cancer of the larynx. Intubation, this is sending in a tube into that airway through the larynx. This is done to people who are in a coma, sometimes who need assistance with breathing or during surgeries. A lot of times they do this when they put you under for surgeries. Croup. Croup in Old English means to cry out loud. It has that barking cough, upper airway infections in children. Then stridor. Stridor is this high-pitched sound because there's this obstruction in the airway, and so as air is trying to pass through it, it's creating this really high-pitched sound. Lower respiratory tract. So that lower respiratory tract consists of the airways that have two main functions. One of those functions is to transport oxygen to the blood capillaries, and the other is to transport carbon dioxide from the blood capillaries. So that exchange of these gases with the blood capillaries is accomplished by the alveoli, those really small air sacs that kind of look like a bunch of grapes. That trachea, that windpipe, this is what takes that air from that larynx down to the chest where it divides into right and left sides, giving us those main bronchi, which are going to go into that right or left lung. The tracheobronchial tree, that's what divides or branches, hence the word tree. It's going to continue to branch and branch off into more and more air spaces. The main bronchi divide into those secondary bronchi, as I mentioned, a bronchus for each lobe of the lung. Each secondary bronchus divides into tertiary bronchi that are going to supply segments of each lobe. The tertiary bronchi divide into bronchioles, which in turn divide into several thin-walled alveoli. Around the lungs, just like we mentioned with the heart, there's that pericardium. The lungs also have a double-layered membrane that's wrapped around them. It is known as a pleura. So those tertiary bronchi divide into many bronchioles, which are going to turn into respiratory bronchioles, which are going to turn into terminal bronchioles. Those terminal bronchioles end at those alveoli, those thin-walled kind of grape-like structures. It looks more like a flower. And then we have respiratory membrane, which is the site where most gas exchange occurs between the blood and the capillaries. Surfactant. Surfactant is a fluid kind of in a way that is produced by the cells inside the alveoli, and it helps to keep those alveoli inflated. It prevents them from collapsing down. Once those alveoli collapse, it's a lot harder to take a breath to get air to pop them back open again. That's the best way to put that. Lobe. Each of our lungs are divided up into lobes. Our right lung has 3 lobes. Our left lung has 2 lobes. And our left lung has 2 lobes because the heart also sits more to the left. So that takes up some of that space in that chest cavity, which makes it have less lobes than the right because the right just has more space. Both of our lungs sit on top of the diaphragm. The diaphragm is that main muscle of breathing. It also divides that chest cavity from that abdominal cavity. So those 2 areas kind of separate off on their own. The mediastinum. Medius means is the median or the middle of that thoracic cavity. It's that area between the lungs containing the heart, the aorta, the vena cava, the esophagus, the trachea. The mediastinum contains the heart. Pleurisy. This is inflammation of that pleura, that membrane that covers those lungs. And it also lines the ribs of that thoracic cavity as well. So some of these are already written out here, but we have alveolus, which means hollow sac in Latin. Alveoli is that plural form. It's that terminal element of the respiratory tract where gas exchange occurs. Bronchus means windpipe in Greek, or bronchi is plural, one of 2 subdivisions of that trachea. Cilium, eyelash in Latin, or cilia for plural, is little hair-like projections that come off of the cell surface. Rail, that's singular in French, means rattle. Rails, plural, is that crackle that is heard with a stethoscope when air bubbles through the liquids in the lungs. So if somebody breathes in, you're hearing these crackling sounds. They're known as rails. Sputum in Latin means to spit. Sputa is plural, so matter coughed up and spat out by individuals with respiratory disorders. Trachea is Greek for windpipe. Tracheas is plural. This is the air tube from the larynx to the bronchi. So all 3 of these words are going to have, technically they have peration that is the same. Not all of them have spiration because expiration technically does not have that S found within the word. So if we're looking at these words, expiration, we have inspiration and respiration. Spirate that we see here, spirate means to breathe. Ion is process. So expiration, prefix X, prefix in, and prefix res. And that ION is our suffix. A normal adult is going to take, according to your textbook, 10 to 15 breaths per minute. In the medical community, it's usually 12 to 20 is what I've always been taught. And I've been taught again in nursing school as 12 to 20, but your textbook says 10 to 15. So we're going to go with 10 to 15 for this, for your textbook's sake, but just know that it's normally 12 to 20 breaths per minute. So during inspiration, that diaphragm is going to move down, which expands, gives extra space in that thoracic cavity. That drawing down of that diaphragm and that expanding of those ribs is what causes air to move into the lungs. When that diaphragm relaxes during expiration, that relaxing of that diaphragm reduces the size of that thoracic cavity, which causes air to be forced out and us to breathe out. The process of inspiration and expiration gives us respiration. So coughing. Coughing is a function that is used to clear any kind of irritants from that lower respiratory tract. Could be mucus, could be allergens that got breathed down there, something that's tickling the back of that throat, that lower respiratory tract. We're trying to cough it back up or out, and you can swallow it down because your stomach is very acidic. Dyspnea is that shortness of breath, which is also abbreviated SOB. Cyanosis is that blue-gray color, the lips, whites of the eyes, that mucous membranes, and those nail beds. So those mucous membranes would be inside the mouth. So somebody who has really dark skin, you're not going to see that blue color of their face, of their lips. You'll see it in their gums of their mouth. Cyanosis is caused by decreased blood oxygen. That's going to lead to lower levels of the hemoglobin or oxyhemoglobin. Those changes in breathing rate. We can change our breathing rate depending on our oxygen and carbon dioxide levels in our blood. The more carbon dioxide, it causes you to breathe either deeper or faster. Exercising is going to increase your breathing rate because we need to get more oxygen to the tissues, to your muscles faster. Sleeping slows down your breathing rate. You don't need as much oxygen when you're going to all of your tissues to move around because you're laying still when you're sleeping. Your brain is still going to consume the same amount of oxygen, but the rest of your tissues are not. Sneezing. Sneezing is usually, again, just like coughing, but sneezing is more for upper respiratory irritants. Sneezing is that upper, coughing is that lower. Hiccup is actually a spasm of the diaphragm. If you pay attention, your diaphragm lines your rib cage. So next time you get hiccups, you kind of pay attention to where you feel it. You can kind of feel that hiccup coming from that diaphragm. And then yawning. People yawn because of hypoxia, so they don't have enough oxygen, sleepiness, or boredom. I mean, I tend to yawn quite a bit for hypoxia. I've had teachers call me out on it before, and I've had to give them a little medical educations because it's not just because you're tired or bored. People will do it because they don't have enough oxygen in their blood. And if somebody is anemic, don't have enough red blood cells, they're going to be yawning because they don't have enough oxygen in them. So all three of these words dyspnea, dysphagia, dyspepsia. Has the same prefix mean of dis. This, this means difficulty. So dyspnea is difficulty breathing. This usually leads to that shortness of breath. Dysphagia, this is where people are gonna confuse things. This has to do with breathing. Dysphagia has to do with swallowing. So somebody with dysphagia has difficulty swallowing. Dyspepsia. Dyspepsia means digestion. So dyspepsia means somebody has difficult digestion. Here, every one of these words has this penia. So we have bradypenia. Brady means slow. Penia means breathing. So bradypenia, slow breathing. Dyspnea means we just difficulty breathing. Eupenia means normal breathing. U is for normal. Hyperpenia means deeper and more rapid breathing. Well, tachypenia just means rapid breathing. Some abbreviations here for us. ABG. Arterial blood gases. COPD. Chronic obstructive pulmonary disease. CO2, carbon dioxide. O2, oxygen. RT is a respiratory therapist or respiratory therapy. Same thing, just a person who does respiratory therapy. All of these terms involve some sort of secretions from the respiratory tract. Expectorate is to cough up and spit out mucus from the respiratory tract. So we're coughing up and spitting out. We've got hematosis. Hemo again means blood. Phlegm is another term for mucus that is coughed out of the respiratory tract. And sputum is any matter that is coughed up. Lower respiratory tract. Acute bronchitis is either viral or bacterial infection that's going to lead to excess mucus production, which causes airflow obstruction. So they have problems getting that air out and in because of an infection of the bronchi. Chronic bronchitis is an obstruction of airflow, could be cigarette smoking, or repeated episodes of acute bronchitis. Bronchiolitis is inflammation of the bronchioles. It says the word bronchiole in there. These are the smallest airways in our lungs. So it's often because of inhaled pollutants like secondhand smoke. This bronchiolitis can be severe in children whose bronchioles are still extremely small. Pulmonary emphysema. This is a type of COPD, chronic obstructive pulmonary disease. These people, all of those little alveoli, a lot of those alveoli get destructed. So those air spaces are a lot larger. What used to be like four alveoli are now two. So there's decreased surface area. And in that decreased surface area means that they're getting less oxygen into their blood. So in pulmonary embolism, these people tend to have more of a barrel chest because they're breathing so deep all the time. CAO, chronic airway obstruction, is commonly known as COPD, chronic obstructive pulmonary disease. And COPD can be, as I mentioned, it's that pulmonary emphysema, also chronic bronchitis. Bronchiectasis, this is caused by repeated infections. It is an abnormal dilation of the bronchioles. Bronchial asthma. By acute episodes of bronchial obstruction caused by bronchial constriction, so those airways getting a lot smaller. Somebody who has bronchial asthma is going to, when they're having an asthma attack, they'll have this wheezing sound. Wheezing can be heard on inspiration, expiration, or both. And it kind of sounds like music, tunes. Probably the best way to describe that. And then we have cystic fibrosis. Cystic fibrosis is an inherited disease where their mucus that is being produced in that respiratory tract is extremely thick. That very thick mucus is blocking that airway. We mentioned that cilia from slides up. There's cells that have that cilia, those little hair-like projections off of them. Their goal is to help move that mucus up to the back of your throat, which is what triggers you to cough it out. Someone with cystic fibrosis, that mucus is so thick that it kind of paralyzes that cilia. That cilia can't move. So that mucus just continues to collect. Pulmonary edema. Edema means we're collecting fluid. So pulmonary, telling us where we're collecting fluid. Pulmonary edema means we're collecting fluid in lung tissue. And this is usually because of heart failure, is why we're getting pulmonary edema. It's usually a side effect. CAO. I had mentioned it. Chronic airway obstruction. COPD is that chronic obstructive pulmonary disease. CF is for cystic fibrosis, and CHF is congestive heart failure. Congestive heart failure is one of the leading causes of pulmonary edema. Congestive heart failure, that heart is not pumping the way it should. Blood is backing up, so blood starts backing up into the lungs, which causes excess fluid to start leaving the lungs and leaving the blood and getting into the lungs. Auscultation means to listen to body sounds with a stethoscope. You can auscultate the heart, you can auscultate the lungs, you can auscultate the digestive tract, you can auscultate blood vessels. Rhoncus or rhonchi, plural, is that wheezing sound that is heard upon auscultation because of an obstructed airway. And rales, these are those crackles that are heard when air bubbles through those alveoli, these air bubbles moving through those alveoli that are filled with fluid. Pneumonia. Pneumonia is an acute infection of those alveoli in the lung parenchyma. It can be viral or it can be bacterial. We can have lobar pneumonia, which means it's only in that one specific lobe. Bronchopneumonia is an infection of the bronchioles that spreads to the alveoli. Pleurisy is this inflammation of the pleura, that lining around the lungs. It can cause too much fluid to accumulate in this pleural space. It's that double-lined membrane. There's two linings to it. So in between the two, there's usually this pleural cavity, and it can start to fill up with too much fluid, and that can cause pleural effusion. Pleurisy is going to occur as a complication to pneumonia. Lung abscess can be a result of a bacterial pneumonia or cancer. Treatment for that lung abscess can be antibiotics if it's from that bacterial pneumonia, or surgery if it's from that cancer. Another term for us. Those of you who want to work in a hospital, you will probably see this. Thromboembolism. This is that embolus that we talked about in the the cardiovascular chapter, that blood clot that was stuck to the wall of a blood vessel lodges loose. It travels through the circulatory system, and then it comes to the lung, and it's going to get stuck in one of those pulmonary arteries, and it's going to cut off blood supply to that section of the lung. Somebody with a thromboembolism is going to have chest pain, dyspnea, shortness of breath, tachypnea, so rapid breathing and hypoxia, low blood oxygen levels. Tuberculosis. This is this chronic infectious disease of the lungs, and it's kind of an opportunistic type of infection. So people who have a compromised immune system are more likely to get tuberculosis. Opportunistic types of infections, they're different bacteria or whatever that live already in our system, but we have other bacteria that are going to keep that one bacteria or that one microbe in check so it doesn't grow too much. But if something were to come in and kill that bacteria that was keeping, or that microbe that was keeping the other microbe in check so it didn't overgrow, like an antibiotic sometimes can do, it can allow this other microbe to grow really fast, and it can cause these different diseases. That would be an opportunistic type of pathogen or infection. Then lung cancer, usually known as bronchogenic carcinoma. It usually comes from that mucosa of the larger bronchi, which accounts for 90% of all lung cancers, and it's usually associated with smoking tobacco. Tumors will start to obstruct the bronchus and can metastasize to the lymph nodes, liver, brain, or bone. So these different abbreviation, ARDS, we've got adult respiratory. There we go, respiratory. Distress. Adult respiratory distress syndrome. It is a sudden life-threatening lung failure in which those alveoli fill with fluid and then they start to all collapse. NRDS. Neonatal respiratory distress syndrome. This isn't where those immature alveoli in those newborns, neonatals, that newborn, are going to collapse, resulting because of a premature birth, and they don't have enough surfactant yet. Surfactant doesn't come until very late in development. There is a shot that can be given to a newborn that is like an artificial surfactant that can help to open up and keep those alveoli open once that newborn takes its first breath. But in premature babies, a lot of times they're lacking that surfactant. So they have to, so it can cause this neonatal respiratory distress syndrome. ARF, acute respiratory failure. And this results in inadequate tissue oxygenation, because if your respiratory system isn't working, you're not breathing, you're not bringing in oxygen, your tissues are going to die. Atelectasis is a collapse of a lung because of a bronchial obstruction. So let's look at the root here. The root is whoops. Doesn't want to do what I want it to do. There we go. Dilation. That one didn't either. Ectal is incomplete. Hemothorax refers to blood in that pleural cavity. And it tends to happen when blood is present in pleural effusion. So we have the roots, hemo, which means blood, and thorax, which means chest. Pneumothorax. This is the entry of air into that pleural space. What causes it can be spontaneous, it can be unknown, or it can result of trauma, like a fractured rib, stab wound, gunshot wound. So the combining form is that pneumo for lung or air. Each of these terms here contains that osis. Osis means an abnormal condition. And each term here is going to refer to a chronic lung infection. of some sort. Pneumoconiosis, it's just a general term that is used for chronic lung infection. It's usually caused by the inhalation, breathing in of some sort of irritating dust or droplets of something that's irritating. Asbestosis is specific to breathing in asbestos or asbestos. It can cause pleural cancer, known as mesothelioma. Silicosis is that breathing in of silicone or cilia particles. It's also known as stonecutter's disease, just because people who are stonecutters around that stone that they're cutting has a lot of cilia in it, or silica, sorry, can't talk. Anthracosis is caused by inhaling coal particles. And sarcoidosis is an idiopathic fibrotic lung disease. Those lungs become fibrosed, or it's like scar tissue is the other way to describe that. So aspiration and thoracentesis. Aspiration means the removal by suction of a fluid or gas from a body cavity. Thoracentesis means the removal by a needle. So aspiration is using suction, while that thoracentesis is using a needle to move fluid or gas from that thoracic cavity. That's the difference, and they both mean to remove something from that lung cavity. So let's look at these diagnostic and therapeutic procedures and the pharmacology. So a spirometer. There's several different types of spirometers. What a spirometer does is it's measuring the volume of air that a patient moves in and out of their respiratory system. We can use it to measure the air. We can use it to promote breathing by having to reach a certain point on that spirometer every time they breathe in. So there's different spirometers for different purposes. We have a bronchoscopy, which is used to visualize the bronchi. So they're going to send a little camera tube down. They can also take a biopsy if they need to, or they can watch the bronchi to obtain and remove secretions. A mediastinoscopy uses an endoscope to look at the mediastinum. So again, they're sending on that little camera to stage lung cancer and diagnose masses. Thorectomy is an incision through that chest wall to obtain an open tissue biopsy from the lung, the pleura, or just that mediastinum in general. FVC, that forced vital capacity, the amount of air that can be taken in. Perf. Peak expiratory flow rate. CT is that computed tomography. We've mentioned it before, but this is a method to look at different tissues in the lungs. That CXR is specifically for a chest X-ray. With a chest X-ray, you can see if there's fluid in the lungs. You can see if there's any kind of tumors or masses in the lungs. So you can use a chest X-ray for quite a bit. AP means anterior or anteroposterior or anterior to posterior. So when you're taking that chest X-ray, what you're doing is you're taking it from the front. That's what you're doing. PA, posterior to anterior. So you're taking that chest x-ray from behind. MRA is magnetic resonance angiography. So this is used as a method of diagnosing lung or other tissue conditions. And then we have a PET scan, which is a positron emission tomography, which is used to differentiate between benign and malignant tumors. Different rehabilitate or therapeutic procedures now. Now we're looking at ways we can treat things. Pulmonary rehabilitation includes education, breathing exercises, and psychosocial support for patients with respiratory disorders. Because sometimes treating that mental side of everything can help heal things faster. Nutritional support. We need to make sure patients are, number one, getting the right nutrition, but losing weight can actually help people breathe better. That dyspnea, that losing weight will help with that. And intubation can be used to maintain that airway open in a patient who is unconscious. Pulmonary resection is a surgical removal of lung tissue. There's different types. We have a wedge resection, which is the removal of a small local area of diseased lung. A segmental resection, which is the removal of lung tissue attached to a bronchiole. A lobectomy is removal of that entire lobe. Or pneumoectomy, which is removal of the entire lung. Tracheotomy is an incision made into the trachea to provide a temporary airway so that a tracheostomy tube can be inserted into that airway of someone who is an airway that is obstructed or a patient who is paralyzed. And then that mechanical ventilation is used in conjunction with this tracheostomy here to provide artificial breathing to a patient. So that tracheotomy will put a tracheostomy, and then they'll use that mechanical ventilation to help that person breathe. So some different medications out there. We have bronchodilators. A bronchodilator will work to relax the smooth muscle in the bronchioles. So those smaller airways, it dilates them, it makes them larger, so it's easier to breathe. Anti-inflammatory drugs can be used in asthma and COPD. Mucolytics can help break up the mucus so it can clear up that airway. And then there's antibiotics that can be used for infections, bacterial infections specifically, because that bio is for bacterial. They only work on bacterial infections, not viral. Oxygen can be used for somebody with hypoxia to help increase that blood oxygen level in patients with that severe COPD. A CPAP. This is continuous positive airway pressure. So this is a method for patients with COPD. They'll also use this for people who snore to help that positive airway pressure is helping to hold that airway open when people sleep at night. So it allows them to continue breathing all night. PDT, postural drainage therapy. This involves positioning and tilting the patient to use gravity to promote drainage of secretions from the lung. And then PEEP is positive and expiratory pressure. This is another technique that uses ventilation to keep the alveoli from collapsing in acute respiratory distress and that neonatal respiratory distress syndrome. Respirator and ventilator are both terms for a device that breathes for a patient and provides mechanical ventilation. So let's look here. Re, that suffix or prefix, that means again. Spir, to breathe. Eater means person or thing that does something. Ventil, wind. Ater, that person or thing that does something. Bronchoscopy and mediastinoscopy are both visual examinations using an endoscope, so a little camera going down. Bronchoscopy is the visualization of that bronchial tree, while that mediastinoscopy visualizes that space between the lungs. So that lobectomy, pneumoectomy, and segmentectomy, there we go, are all excisions to some, taking out certain structures within the lung specifically. So that lobectomy is that lung, the lobe of the lung. That pneumoectomy is the removal of that entire lung. Segmentectomy is the removal of just a small segment. It can be that lung tissue. It can be an organ, another organ. It doesn't necessarily refer just to the respiratory tract, but you can do it to other places. Thoracotomy and tracheotomy are both incisions into that respiratory system. That thoracotomy is an incision into the chest wall. That tracheotomy is an incision specifically into the trachea. So the upper respiratory tract is everything that's up in the head, pretty much, up into like the top part of the neck. That lower respiratory tract is everything below it. There's different structures in that upper versus lower respiratory tract, and it helps to enable you to figure out which kind of disorders may be happening. If you have any questions, feel free to reach out. Otherwise, have a wonderful day.